Okay, good morning, everyone. The COVID-19 situation has been developing rapidly, and with new information and advice released daily. So, keeping in line with our commitment to the health and safety of our employees, the city of Corner Brook is entering into our business continuity transition plan. It is in effect right now. Came into effect this morning. So we've sent employees home with the exception of our core services staff, and the following services will have only minimal disruption. We will be continuing snow clearing, water and sewer operations, garbage collection, transit services, fire protection services. Again, these will be sort of operating pretty much as usual, with some minor sort of delays maybe in our ability to interact with the public. We do have our customer service line still available for calls to our 637-1500 line. Emergency calls and any concerns like a water or sewer problem or any kind of traffic problem or anything like that, please continue to call our 637-1666 number. Tax payments. I know that everyone's thinking about paying their taxes now, I'm sure. But you don't have to come to City Hall to do that. You can do that by mail or through telephone banking or online banking. And of course, please call the 1500 number if you need to avail of any other city services. And again, we'll figure out something. But there's no need to come in. Now, as per recommendations of the Chief Medical Officer, residents are advised to stay home as much as possible. Again, taking measures of social distancing measures that everyone's talking about, of course. But businesses are not ordered closed at this point. Really, I think that's it. Do we have any questions?
Not in terms of enforcement, but in terms of overseeing that a lot of these measures are followed. Does the city play a role in that?
We have certain powers available to us when it comes to things like states of emergency and that. To be clear, we're not there yet. We're receiving direction from the Department of Health when it comes to, I guess, how our citizens and our businesses and things should operate. Of course, we've taken measures to limit public access to our buildings and as well to the Civic Center and recreation facilities. But at this point, businesses are not ordered closed. Of course, they should be following the recommendations of the Chief Medical Officer when it comes to limiting interaction with customers, reducing staff as much as possible. And really, though, it's going to be a very difficult time for businesses in the short and medium term. So at this point, we are taking direction from the Department of Health, but we would echo their recommendations and urge, I guess, businesses and citizens to follow them.
I guess in terms of the communication with the province and the daily updates that are happening there, what kind of communications does the city have with the province on this matter?
Well, I can answer that. We're monitoring all the health reports that are coming out from the province on a daily basis. We also have a fire and emergency services conference call that's occurring sporadically throughout this process, and we're being provided updates from there.
Are you guys happy with the way the province is handling things?
I will say that I think that it's important that we trust our public health authorities to give us the necessary information. It's very difficult in today's world with, again, we see news from all over the world. We get a lot, of course, social media is a big part of our lives now. It's important more than ever, I guess, to trust the authorities at the provincial and federal level to give us good public health advice. And I would strongly urge, I guess, our citizens to take that advice.
Todd, can I get you to explain from an emergency measures perspective what exactly the city is doing differently, I guess, just from an overall public safety perspective?
Well, the city has limited its, let me grab this, Don. The city has limited
Can I get
its,
you to just move over so you're on the right, please? Thanks.
the city has limited its operations here at City Hall, and we are providing a telephone service basically, and that's where we are. We're using essential staff to deal with the core services that need to be delivered to the city. For instance, our fire and emergency services is active, fully manned, and ready to respond.
But in terms of proactive things as opposed to reactive, like, are you taking any extra measures, any things that would be out of the ordinary to protect public safety or even the safety of your staff?
Well, really, we're following the lead of the province on this and the federal government. This is new territory for all of us, and we are watching them and letting them lead the way on this. As far as the city goes, we'll be recommending that be followed. As far as restaurants and bars, these institutions may need to close. If they stay open, they're going to have to look at the capacity drop of 50%, things like that. We are making strong recommendation that our residents follow those recommendations. So.
I know in the past, speaking to you and your predecessors, there is always emergency operations training. You do tabletop exercises, you've done mock disasters.
Absolutely.
Has this been something that you were able to prepare for at all? Is this something that anyone has been able to envision and even train for?
Don, this has taken us into total new territory. We have a pandemic plan. However, it's being followed to the extreme measure right now. Our reactions are extreme compared to what our plan actually says. So we are just following the province and the country on this.
So how much of an effort is it to, I guess, make those adjustments on the fly when you'd like to think you were prepared based on, whether it be a flood or a blackout or things like that you know are probably likely?
Yeah, so when we do planning for emergency management, it's an all hazards approach. All the commonalities of responding to emergency are there. How we activate and respond is what's different. And the response is different here in this one. And we're just being led by the province and the country in this.
Mayor, if I could ask you from a planning perspective going forward, just in terms of running the city on a day-to-day basis, this is the time of year you would start thinking about, making adjustments for spring and the things that come with spring and summer. Does all that go on hold now because we don't know if we're going to have a normal spring and summer?
Yeah, there's definitely nothing normal right now. We're taking this, I guess, like everyone, on a day-by-day, hourly really approach. We have a plan in place now for we've sort of gone to our core services to make sure that we can provide the essentials: water, wastewater, transportation, and fire protection, of course. And that's our first focus, keeping our employees safe and able to do the job. So we've sent the rest of the employees home for now. Managers, of course, will work on plans to be able to get people working from home and doing that kind of thing. But in the short term, I guess, we are just trying to make sure that we are taking appropriate measures so we can provide the essential services that we need to provide. From a spring and summer perspective, I think that no one right now knows how long we will be in this position, this hunkering down posture right now. So we do have, I guess, to Todd's credit, we do have an EMO plan, and I guess the mechanisms and the structures in place to be able to deal with this emergency, even though it is very different than a big snowstorm or flooding and that kind of thing. We enacted, I guess, the preliminary measures of that. We're not in a state of emergency situation here yet, and that may change, but we may also be in this current position for quite a while. So we do need to be able to provide services. And again, as we make the transition to people working at home and things like that, we will start to focus on our regular business. So we can facilitate, services like being able to do development inspections and things like that. We'll be able to provide, I guess, and look forward to our plans for things like tours and business services. One big thing I think that we will be doing sooner rather than later is really focusing, I think, on small business and how we will be able to help through, again, important partners like the federal government to be able to keep them on their feet. This is this is an economic crisis as much as it is a public health issue. And again, we hope, and again, I'm going to be optimistic and say that we will have supports for those businesses, but it's going to be a very difficult time for them. So clearly, that's going to be one issue. Another issue that we've talked about, I know the city manager was, we were talking about just then, was what our role is from a larger sense for the community, and pulling together, I guess, things that the city normally doesn't get involved with, like coordinating getting people health services or food banks. We have a community services committee, an external committee, and I would suspect that the next week we'll be, having a conference call with them to figure out ways to help facilitate services that normally the city probably wouldn't be directly involved with. Just because we are able to, we have some capacity, and we are we're the boots on the ground. So it's going to be it's a wait and see, an hour by hour transition. But we have a plan for core services, and we'll expand from there, I guess, based on keeping our employees safe and the safety of the residents.
You mentioned earlier that stores and businesses and whatnot haven't been ordered to close. Do you have the authority as mayor to do that, or is that something that has to come from the province? And if so, what are you looking at in terms of how will you make the decision? Will you get to a point where you say, okay, it's probably time?
We do have powers, I guess, under our act, state of emergency powers. Of course, the recommendation to go into a state of emergency will come from Todd, the city manager, and that's based on our EMO plan. And when, I guess, you pull the trigger on those things, it does give us special powers to order businesses closed, to order people off the street, and there is a broad category, I guess, at the end of that section, and it says something like, and any other measures necessary as seen to support, I guess, public safety. We're not there yet, and I want to stress, I guess, that we're in an early stage of a potentially long process. Of course, if we need to do that, we are ready and able to do that. We're not there yet, and we need to, as much as possible, allay fears and panic around this issue, and just get people being aware of what's being communicated from local authorities and the provincial government, federal government, and not and really like just taking a deep breath right now, because there is, I know a lot of people are very, very anxious right now.
I've got a human resources question. I'm not sure if the city manager might be better for this. I'll leave it up to you guys. You talk about down to what I'll call skeleton crews now in various departments and whatnot. Has there been any thought given to what happens in a situation, for example, let's take the depot right now. You're down to the people who are clearing the roads and plowing the street. If you get a positive or even a symptomatic employee at the depot, I would imagine that most people in that building would have to be isolated, at least on that particular shift. You don't have a whole lot of people to deal with to begin with, so how does that play into what you're able to do, and are you concerned at all that you might get into a manpower situation simply because of isolation problems?
Yes, so right now we would follow the protocols of the province with self-isolation and make sure that the individuals are isolated by that they have come into contact. But we're quite confident that we have enough individuals trained, particularly in totally core services like our water plant and fire services, that we would have enough people to continue the operation. Many managers are cross-trained, and most of us are, so that we have a really good continuity plan in that regard.
In terms of those core services, what kind of preparation did you make in terms of the staff and how they can perform those duties safely?
I think, our staff over the years has done a really great job in doing the training and making sure that there were redundancies in our system. And, that often pays dividends. It's not something that we could have trained people to do the water plant, overnight. But we've had them trained and we've had managers trained so that when a situation happens like this, we're prepared to have extra people who can operate the facility.
And just to add to that, from our plan, the idea that we're going forward with is to rotate staff. So the reason we're sending staff home is to have staff available to come in and help deliver these core services if need be.
And there are, I guess, specific measures that we have taken. If I could, just we listed some out here. We are taking mitigating, measures. So, for example, limiting public access to our fire hall, taking measures there to enhance hygiene and things like that. As we mentioned, the water plant, we've got sufficient capacity there to a certain extent. That system can be operated remotely, but there are some core on-site duties that have to be done. But we'll do that as little as possible. Then, for the depot, for example, we're calling in staff as we need them. Rather than congregating at the depot, if there's a water break, our team gets a call and they deploy. And that just is, again, a way of social distancing, keeping people apart, so we don't have a mass incident of absenteeism from our staff. Civic Center, same thing. We've gone down to basically nothing at the Civic Center. And so there are a number of redundancies, and we have sort of worked out a good plan, I think. And I think that the other important thing is we didn't want to rush to that. We want to make sure we're doing it right. We don't want to incite panic or anything like that. There's no need of that. But there's a good plan in place so we can provide core services and different levels of services if we have to. So our water plant, we can offer water as it is coming out of the plant right now. But if we had to, we can shunt water around and provide it chlorinated but not treated. We can also provide it directly, in the worst case scenario, in a boil order type situation. So we do have, a number of levels of redundancy built into how we're doing things. And again, we probably should feel quite comfortable with the professional work that the staff are doing. And so it's a bit of a battle, but we do have plans in place.
Everything we talked about this morning is we're in a situation where there's no positive cases confirmed in Corner Brook or within the Western Health region. Does any of what you mentioned this morning change once we get that first confirmed case within the municipality?
I think that, we will have cases. I think it's, and that's what we're hearing from the Department of Health. It's inevitable, I think, in the global sort of world that we live in. Again, it's about managing this, containing it as much as possible, but about managing it. And I will really look to the province in terms of any additional measures they will take on. I'm sure Western Health will come out with additional plans in the coming hours, days, weeks, and we'll support that. But I think that we will go from a phase of, right now, it's very difficult and frustrating sometimes for us to wait for something to happen, and to a phase where we'll have to manage risk more. There are going to be a number of cases around our city and our province. I think that things changed a little mentally when we got our first case in the province. They'll change again as they reach the different communities. But really there's, again, no reason to panic. It has to be managed, and it will be managed. And that's something we'll deal with as the time comes. We have plans to go to even further extreme measures for protecting employees and things like that, but we're not there yet.
Well, would you anticipate going further would be something that would happen once we cross that threshold of confirmation?
We won't take our cue from the incidents itself. We'll take our cue from the public health professionals, if that makes sense. So we won't pull a trigger on something because there's a case in Corner. But if the Department of Health tells us that, we should be taking other measures, or the province should be taking other measures, then of course we will deal with that. And there's other aspects to it too. There's social and economic aspects, that we're going to be concerned about going forward, making sure that our non-governmental organizations and our partners in the community have the resources they need, whether or not we have to interface with certain types of businesses like pharmacies or groceries or other sort of services that people will need in the coming weeks and months. And we will deal with that, I guess, but it won't be because there will be like a new case or multiple cases. We'll take our health direction from the province because we, quite frankly, don't have that expertise in-house. But when it comes to community support, we'll definitely sort of factor in there.
Good. Great. Good.
Yeah. Okay. Thanks, guys.
Thank you.